Thank you, Danielle. Pediatricians on high alert for cases of multi-system inflammatory syndrome. It's a condition that causes very serious symptoms in children weeks after they were infected with COVID-19.
So the Alabama Department of Public Health reports that those children affected with MIS-C had the virus that causes COVID-19. News 19's Archie Snowden spoke with the ADPH about the condition and has information on what symptoms you need to be looking out for. Archie?
Okay, thanks, Yvonne. Fever, vomiting, abdominal pain, and a rash. Those were just some of the symptoms affecting children that were found to be linked to COVID-19. The condition was first identified at the start of the pandemic, but doctors now are seeing more cases in the past few weeks. The condition causes different body parts in children to be inflamed.
Inflammation of the body, fever, and dysfunction of at least two organ systems, those being things like the heart, the lungs, the brain, or the kidneys.
Doctors across the country say that children are being admitted to the hospital, including several last week, with many requiring a stay in the intensive care unit. Multisystem inflammatory syndrome was first identified at the start of the pandemic in 2020. Most of the patients between the ages of 5 and 21 were not vaccinated against COVID-19.
After the original COVID-19 infections that were happening in children, they started to see this present, and then over time it was given a name and then described. At this point, we've seen over 6,000 cases and had 55 deaths associated with this syndrome.
When first diagnosed, doctors admit they weren't sure what they were seeing in children who became ill. Children being admitted for fever, swollen hands, and problems with their stomachs. Researchers determined that MIS-C was developing in children who had COVID-19, even if the cases were mild or asymptomatic.
And then the good thing is that we've learned a lot about this and how we can treat it. And so again, at this point, almost all children recovered from this fully, although they are very, very sick. Generally, the disease shows up between 2 and 6 weeks after the infection. And like I said, almost all of them have been associated with either recent COVID infection or a recent suspected COVID infection.
Stubblefield adds that the COVID vaccine has shown to prevent over 90% of the effective against MIS-C. The vaccine is now approved for ages 5 and older, and he says it will prevent severe symptoms and severe outcomes. Correct?